say I'm an individual that is experiencing pretty severe depression. What are some of those resources that are available in the community? And this is, for someone that's listening that just signed on to this video and has no really understanding or education around what are some of the resources available, whether it be right here in Centennial or more broadly across the city and the community. Where can I go to get help?
Lots of places. I'll start with medical because we don't have a medical person represented here. But pediatricians, physicians, if you've been to the doctor recently, you've been asked a couple of screening questions. So I think just that's a place where you can speak to a physician about this and they can help connect you with resources. The same would be true of a teacher, school counselor, or youth pastor, or a coach, right? I think being able to just reach out and start somewhere. So I think I want to view it as kind of it's the wide end of the funnel, right? It's not like you have to have the right answer. You have to start somewhere. I know Molly and Marie can speak to some of the resources they have and how they connect people to services. But what I want to emphasize is start somewhere because there's lots of starting points. That's great.
I think one of the things that we need to say is that if there is a serious issue going on with a teenager, and I'll just say specifically suicidal ideation. If there is a teen that is considering suicidal ideation, there needs to be an intervention immediately. And one of the things that I say to parents a lot is let professionals do their jobs and don't be ashamed of asking for help. And there are so many times when I've had to encourage a parent to take their child to the emergency room so they can have a more clinical mental health evaluation and let that professional decide how serious it is in that moment. If the teen needs to be on a 72-hour hold so they can do some immediate intervention. And I think just, we want to be open. We want to have open conversations. We want to provide a safe space for our kids to talk. But if there is something extremely serious, like medical, I'm glad you mentioned that, Mike, is so important that we intervene right away and we get some evaluation done. And then we can make some decisions and get some advice on some of the other services that might be needed if it isn't as serious as you might initially think. But you have to rule that out first in how serious the situation might be.
And I would add to that, Colorado does actually have a crisis support line that, as we're speaking, especially when it comes to suicidal ideation. So if you're questioning, it's not up to the parent to have to figure that answer out by themselves. Right. So like Marie said, call a professional that can come and provide that support that's necessary to make sure that that child gets the services that they need. And so I definitely encourage that support line.
So what should parents be looking for if a teen is potentially exhibiting some of these suicidal ideation considerations and behaviors? Can you all elaborate just a little bit more on that?
Yeah, that's a great question. I appreciate you raising that because that term suicidal ideation, that's a scary term, right? What does it really mean? And so what are we looking for? Is our kids making reference to, on one level, there's sort of a generic, I just can't do this anymore, right? Well, what does that mean? You can't do this anymore, right? Or I'm not sure I want to be alive, right? And then it goes up in different levels of severity of I'm thinking about harming myself, or I've thought about. Most teens, if we're going to be honest about it, most teens have thought about suicide. That doesn't mean they're going to do it. So I don't want parents to be overly alarmed, but if they've thought about it, can we have some discussion about it? So parents can start that discussion and ask about it. But to Marie's point a moment ago, if you're not sure, ask and get some professional assessment. because we do some further steps in terms of determining, is this just ideation, meaning I'm just thinking about it? And if it goes more to plan, like I've thought about how I'm going to do it, or I'm going to do it, which we call intent, that's scarier. But again, parents and community members don't need to know all of that. If they hear or see warning signs, it's better to ask more questions and get more assessment than to avoid it and hope everything's just fine.
Absolutely.
I know what you guys would like to add to that.
No, I think that was a great summary. I think that sometimes, the symptoms of like self-harming also can be indicative. It doesn't, as he was saying, there's different levels. So it is not necessarily just a jump to that. But I think that is something for parents to be aware of and to engage in conversation with their youth. Because if it's not necessarily needing an assessment at that exact moment, but it does mean that we need some supports. We need something. And so yeah, I would, as Mike said, parents don't need to know all the different levels, but engage with a professional. And there are a lot of professionals ready to help our children. So
Thank you all so much for sharing that. And really to echo what you all were sharing is you all as the professionals and our wonderful practitioners across the community would much rather have someone speak up and say something than not say anything at all.